Hi, everybody. I am Tiffany Clouston, and I'm the Coordinator Instructor for the Medical Laboratory Sciences programs here at NBCC. Those two programs include Medical Laboratory Assistant and Medical Laboratory Technology, so I'll touch on both of those. Both of those programs are only offered at the St. John campus, specifically at the Allied Health Building on the UNB St. John campus. If you're thinking about becoming a medical laboratory professional, you'll become a part of a healthcare team who can help answer questions like, why did they collect so many tubes of blood from my vein? How does the doctor know the best cancer treatment for my family member? Why does my sibling bruise so easily? And how does my doctor know when to adjust my medication? These are all questions that medical laboratory professionals can help address. So first we'll touch on the program structure. So for medical laboratory assistant, it's a very fast-paced 8-month program, which includes 6 months of didactic courses and simulated labs on campus at the college, followed by a 7-week clinical rotation at a hospital. It's important to note that you may not get your first choice of a clinical rotation at a hospital, so there may be travel or relocation involved in that. Then once you're finished with us, if you are successful in all of your courses, you move on to write a national competency exam that's administered through our national certifying body, the CSMLS. And within the province of New Brunswick, it is required that you pass that exam to be able to work for our hospital systems. The courses run Monday to Friday from 8:30 to 4:30, and we do pack those hours pretty full. So the key roles of an MLA are to collect specimens from the patients. So they might be doing that within the hospital or for outpatients at a clinic or somewhere else outside of the hospital. They also prepare all of the specimens for testing. So they might be spinning down the blood to separate the cells from the liquid portion of the blood. They might be aliquoting that off to do testing on different tubes. They could be ordering different tests. They could be processing specimens and packing them properly to be sent to another lab for testing, along with a lot of other things that they are responsible for. Medical laboratory assistants have areas of study that are wide-ranging. They start with phlebotomy, which is the process of drawing blood, so that's something that you should be prepared for if you plan to take this course. And they're also responsible for learning all about the pre-analytical processes in chemistry, microbiology, hematology, and histology. And I'll explain what each of those are a little bit later. Medical laboratory technology students take part in a 2.5-year program. So the first 2 years are spent at the college in didactic courses and lab simulations, followed by a 4-month clinical rotation. Again, this may not mean that you get your first choice of hospital, so it could include some travel or some temporary relocation. Similar to the MLAs, they would write a national competency exam at the end of the program with the CSMLS, our national certifying body, and again, that is required to work within the province of New Brunswick and within most provinces in Canada. The program runs Monday to Friday from 8:30 to 4:30, and once again, we pack those hours pretty full. It's a pretty busy program. Medical laboratory technology students focus on areas of study like phlebotomy, which is once again drawing blood, as well as the analytical and post-analytical processes in chemistry, microbiology, hematology, histology, transfusion medicine, and molecular genetics. So they have a wide array of testing that they are responsible for learning and performing. The key roles of an MLT are to understand how all of the analytical techniques work on a variety of different specimens. We can test anything from a throat swab to pieces of bone to blood samples, pretty much anything that can come out of the body we can test. They also have to make sure that the analyses that they're performing are accurate and that they're following the appropriate quality assurance protocols. So we need to make sure that we're reporting the right results every single time for the patient. There's also a lot of troubleshooting and repair with automation that's involved, so you get to be a little bit of a mechanic along the way as well. In the end, like I said, the goal is to report valid test results to physicians in a timely manner. And of course, there's much more to the job than just that. So I'll touch a little bit on the courses and labs that you'll take here at the college. The first thing we'll talk about is clinical chemistry. So for this, it's really important to know that basic lab math is required as well as basic chemistry knowledge. So we do recommend that you come here with a good understanding of high school level math and chemistry. There is a lot of automation available due to the extremely high volume of tests that are done in the chemistry lab. For example, glucose would be done on lots of patients, electrolytes, and so forth. There are still some manual methods required for some tests. So, for example, you would still do urinalysis manually, which is looking at urine for different things that could be found there, pregnancy tests, toxicology, and so forth. There are still some manual procedures done as well. So you get a good mix of both worlds in clinical chemistry. Then the next discipline is hematology. So you'll learn about the two major sections of hematology. There are the blood cell counts, where you'll learn about all of the white blood cells and the red blood cells. You can see some white blood cells and red blood cells on this slide here. The white blood cells are the big ones that are kind of stained purple and blue, and the red blood cells are the smaller cells that are a reddish pink color in the background. In the second section of hematology, you'll learn about coagulation or hemostasis, which has to do with the bleeding and clotting of blood. So if you know anyone who is a hemophiliac, for example, they would have been diagnosed through the coagulation lab. So we help diagnose a patient with lots of conditions and diseases like anemia, leukemia, malaria, infectious mono, and so on. There's a lot of different stuff that happens in our hematology labs. Then you'll learn about microbiology as well. So the first step in microbiology is recognizing which bacteria is normal and which is harmful to the body. So you'll be growing and identifying bacteria from all different sources in the body. Anywhere they can put a swab, they'll get a microsample from. And then you'll learn how to perform tests to actually be able to determine which antibiotics can best treat that infection. So not only can you tell the physician what the infection is, but you can also tell them which treatment would be the most effective. So microbiology ends up being a big puzzle with lots of investigative work. You'll learn all about different biochemical reactions that the bacteria can go through. You'll have all kinds of flow charts and big puzzles to work through to solve the mystery in the end to treat the patient. In histology, you'll examine each piece of tissue or organ that's received in the lab, and you'll record the gross description. So you'll get a big specimen in a container, and you'll record what it looks like macroscopically, or what it looks like to the naked eye. Then you'll take that piece of tissue and you'll cut it up and dissect it into really, really small pieces. Those small pieces will go into some wax blocks, and then those wax blocks get cut into really thin ribbons and put on a glass slide to go off and be stained. Once they're stained on the slide, they go to a pathologist for a final diagnosis. So on the picture on the top of this slide here, there's a photo of that's a large bowel, and it looks like a lot of little flowers. You'll get to recognize what all of the pieces of tissue should look like from different organs. And just as a little fun fact here, in New Brunswick, anything that's surgically removed from the body gets sent to the lab for processing. So even if you get teeth removed, they'll get sent to the lab for processing, just like any other piece of organ. Then we go on to transfusion medicine. This can be an extremely fast-paced work environment. You've probably seen TV shows that take place in a hospital where somebody will call for 4 units of O-neg stat. And that really does happen in real life. It can be extremely fast-paced in emergency situations where they need blood for somebody who's been stabbed or shot or been in a car accident. That has to happen very quickly. So part of transfusion medicine's job is to actually determine the blood type. And that goes way beyond the typical A, B, and O that you've heard about on TV or just in your basic biology classes. There are dozens and dozens and dozens of blood groups that you will learn to identify in transfusion medicine. Then once that's determined, you have to actually cross-match or test units of donor blood that's been given by people at Canadian Blood Services to see if that is safe to give to the patient. So sometimes the donor blood will react badly with the patient's own blood and antibodies, and you have to make sure that the combination of donor blood and patient blood is safe to give. They also prepare and supply all kinds of other blood products like plasma and albumin, platelets, and so forth. They take care of a lot of different blood products in transfusion medicine. So you'll learn all about that here at the school. If you're considering becoming a lab professional, just some of the skills that would be required of a student are their time management and organization are huge. This is a very, very busy program. It's very intense, very rigorous. So being able to get yourself organized is a critical part of being successful. That goes hand in hand with attendance management. We have a lot of lab time and a lot of it is absolutely mandatory. So you do have to be able to attend on a regular basis. Strong communication is important, a good understanding of basic math and chemistry, like I said, and the ability to follow instructions and procedures. Everything we do in the lab is completely based within our standard operating procedures, and it has to be followed to a T. On the job, it's very similar to the skills that you'll need as a student. You have to be a great communicator. You have to exhibit really good teamwork because it can be a very busy place to work with a lot of pressure, a lot of stress because you have very sick patients on the other end of the work that you're doing. You have to be able to think critically because there will be situations that you come across that you've never seen before, and you have to think very quickly in the moment and make the right decision for the patient. You have to be able to maintain confidentiality. That's critical in our line of work because you may see things that come through on family members or friends that you won't be able to share with anybody else because of the nature of the work. You have to be prepared to work shift work. We do work in the lab pretty much 24/7 in most departments, so be prepared to work days, evenings, nights, holidays. Sick people don't magically get better on Christmas, so you will be expected to work all of those holidays. And then in terms of employment, the locations that our students typically end up working in tend to be hospitals. Hospitals are our main employers for sure. A lot of our students go to Canadian Blood Services as well, and sometimes they'll end up in private clinics or vet clinics, and sometimes in research and manufacturing labs, just depending on where their interests lie. In terms of salary ranges, this is approximate because again, it would depend on where you go to work. It differs from province to province and even within different companies it can change. But the average starting salary for an MLA would be about $20 an hour and they can go up to about $22 an hour. For an MLT, they would typically start around $27 an hour. And then within 6 or 7 years, they can move up to about $36 an hour with a little bit more experience. So if you're looking for more information, the NBCC website has a section about each of those programs, the Medical Laboratory Assistant Program and the Medical Laboratory Technology Program. You can also go to the provincial regulators website. It's the New Brunswick Society of MLTs, and the website address is listed there. And for more information about the certification exam or about the national standards that we teach to, you can go to the Canadian Society for Medical Laboratory Science website, which is listed there as well. And they're the society that dictates what we teach to you. So they have lots of information on there. And you can also contact a lab instructor. So my email address is listed there, tiffany.clouston@nbcc.ca. I'm always happy to give out some information. So thanks for listening, and we hope to see you at NBCC. It's a great program and a great school to go to.